Hello, it's Dr. Samantha, formerly known as Dr. B. I actually just recently got married and changed my name, so it's Samantha S now, but I am going by Dr. Samantha since most of you have seen that. Anyway, I'm super excited because today we are talking about a topic that is usually not spoken about. In the fertility realm, in the medical community, on Instagram, this is not talked about ever. And what is that exactly? It's how trying to conceive during a timed window, so timing intercourse, how that can impact mental health and the relationship of the couple trying to conceive. I think this is such an important topic because at the end of the day, everything is tied together, like I always say, right? And most people just graze over this. So, for starters, welcome to my channel. If you are new here, please don't forget to hit the subscribe button, give this video a like. If you want to see more, please do not hesitate to comment topics that you want to hear about in the comment section, and let's get started. Today we are talking about timed intercourse and how that can impact a couple's sexual relationship. Now, hopefully YouTube doesn't block me or ban me for some of the words I'm about to say, or words I just said, because ultimately I think this is a really important topic to discuss. So, a lot of my couples spend a lot of time learning to time and track their cycle. They learn it, they love it, one, because they're like, I know so much more about my body, I know so much about my partner's body, and that's great, and I'm a huge advocate for tracking your cycle. I love the fertility awareness method. There's a lot of other methods out there as well. I mean, there's so many cool tools out there, like the temp drop, the Aura ring, the keg, the list goes on and on, right? So I am a huge fan of tracking, understanding your cycle, and, learning how your body works from month to month. I am an advocate for that. So this is not a video saying that I'm not. This is just a video that I think touches on something that can be missed often, which is after you track for several years, or you're trying for several years, or honestly, even for just that first year of trying, it can start to weigh on a couple. Meaning, the more you track, the more every time your ovulation time comes around, the more stressful it can be, the more pressure. So a lot of times I'll hear that women feel this overwhelming sense of responsibility that's only on their shoulders because they're the only person that has to track. And they're the person who has to say, oh, it's ovulation time, now I have to initiate. On the flip side, I hear male partners talk about how it can be hard to be expected to perform at a specific time and day for maybe multiple years even. Everyone's fertility journey looks different, but people who've been at this for a while can really feel this weight of intercourse now is more of a job rather than something that the couple does for fun. And so a lot of times with my couples, I like to sit down and have a conversation about, one, how are they feeling with this? Do they feel like tracking's easy? Do they feel like tracking is something that they don't have to work too hard at and it's just part of their journey? Or are they feeling really stressed out? Is it driving a wedge between them? Is it putting a gray cloud over the relationship when fertility is already hard enough, and then we're going to throw in having this issue? No thank you, right? So I like to check in. Some patients are like, nope, we're fine, we're doing okay. And then some patients, which probably more than you'd think, it's honestly why I'm creating this video, say, actually, it's something that we're really struggling with. Whether it's the male side, the female side, or both, honestly. Like I said, it's pressure in different ways for each partner. So one, I hope someone has asked you about that if you're on this journey, which I'm assuming you are if you're watching my videos. But two, I just wanted to speak out because you're not alone. And I've heard this many a times from patients. And I feel like sometimes they're almost relieved to be felt heard and seen in that space because it's something that's not talked about. It's a little taboo. It's still too taboo, which is kind of crazy because I feel like we all talk about so many different things now. Things that I say to do instead. One, I will literally tell couples to stop tracking. I'll be like, just stop tracking if you're okay with that. It can relieve a tremendous amount of stress, and intercourse can start to be fun again. Some people are like, no way, I still need to track. Totally fine. I say, let's try to take a more chill approach, right? So that could mean just using cervical mucus to track. So when you see that cervical mucus, you know ovulation's about to occur. So maybe having intercourse every other day, you know, throughout that period of time, and odds are you're going to hit the window. A lot of times I also like to give the reminder that, you know, there's a 6-day fertile window, right? Sperm can live for 5 days in the vaginal canal, right? So at the end of the day, if we're having intercourse at least once a week, you probably will hit the window. If you're having intercourse twice a week, odds are you're definitely hitting that fertile window, right? So sometimes I just say, if you guys are comfortable doing that, there you go. You don't even have to track anymore. There are those statistics out there that will say having intercourse 2 to 3 days before ovulation is going to be ideal for timing. Then having intercourse every other day during that time period is also going to be ideal. With that being said, like I said, my method of maybe once or twice a week, if that's relieving stress, that's going to be worth it alone, right? Because again, if everything's just perfectly timed, but you're really stressed out, that's not going to work as well as if you're a little bit more relaxed, right? And I'm not trying to say just don't stress, right? I'm just trying to say let's take some pressure off and let's try to reduce the stress as much as possible. So that's kind of one of my methods. Like I said, the other one is just use cervical mucus. You can really tell 2 to 3 days before, and then just kind of try to make it casual, try not to put too much pressure on that. Again, like I said, it's really, really difficult. Sometimes I'll say, plan a date night. Every time around ovulation, you make it a little bit fun. Plan a fun date night, make a reservation, do an at-home painting session. I don't know, that's in right now where everyone's painting their partners. Just try to maybe put a little bit more romance back into that time period. Or like I said, you can just do the once or twice every other week, and that works too. Those are some of my recommendations. You can get really creative with your partner. This is definitely a conversation I recommend having with your partner. You can even show them this video. And starting this conversation, talking about this can be really beneficial, not only for your relationship, but also for your fertility journey. Like I said, at the end of the day, it is treat the whole person, treat the whole system. And if certain things that you're doing throughout your fertility journey are causing you stress, it stops being productive and it starts being counterproductive, right? Now, for those of you who are like, what about learning about our cycle? We need to track to understand. I totally agree. Many times I tell my couples that I need at least 3 months worth of data so I can understand their cycles well, and we can make sure that everything is optimal. However, then they can usually stop. Or they can continue the methods we just previously talked about. They can continue to do basal body temperature monitoring and things like that, but it doesn't have to be as perfect as we were once worried about before. I am definitely from the standpoint that less is more. I 100% put people on probably more supplements than they'll ever be on in their life, and I do give a lot of diet and lifestyle recommendations, but I do think people do still take it a little far, and I am here to try to make things sustainable, especially when couples have been on this journey for years, right? It can be really challenging, even for a few months, let alone years, and we don't want people to put their lives on hold and feel like they're not living anymore because of that. And my job is to help let go of that feeling and to start to try to live more of a holistic, sustainable lifestyle. Again, I know this can be really difficult. The fertility journey is really difficult. It is really hard, and it does usually change you. But with that being said, we can do things to make it just a little bit better, which is starting to have the conversations with your partner. It might be difficult, but they establish boundaries and show that you're paying attention to each other's needs and wants. This example is just kind of one way that I see fertility impact couples' relationships, and it's something that I just wanted to draw attention to. And one, normalize it, not take away from the experience, but just share that you're not alone. And to two, give other recommendations and other insight from a practitioner who sees you more than just a number, but sees you as the whole couple that you are and wants to make sure that you have a sustainable and happy life. With that being said, if you have any questions, please don't hesitate to reach out in the comments. Don't forget to subscribe to my channel and like this video. I am coming out with videos every single Friday, so be sure to turn that notification bell on. And if you're looking for any of my additional resources, please check out the description. Links will be there for you. I hope you have a beautiful rest of your day. Don't forget to check out my next video.